Word on Health, the report with its finger on the pulse of popular medicine, with Paul Pennington. Word on Health, for your very best of health. Hello and thank you for listening. In this edition of the Word on Health podcast, I'll be talking to actor, comedian, writer, director Chris Addison. But first, I'm looking at fibromyalgia. Des Quinn is the chair of the charity Fibromyalgia Action UK. Des, to start with, if survey data is to be believed, we have as many as 63% of people outside of those affected who don't know what fibromyalgia is. So could you give us a breakdown on how it affects the body?
It's described in terms of a widespread chronic pain. So that's pain that it's lasted for 3 months, 6 months perhaps. It's went beyond the body repairing itself. To be honest, in fibromyalgia, we don't quite understand why it's happening, but it's all over the body. But it's more than just pain. You have non-refreshing sleep. You're waking up in the morning, you've had 8 hours, and you don't feel as if you've had the benefit of it. There are cognitive issues as well. We call it fibrofog within the community, and it can be word selection issues where you're about to sit down at a table. Could you pull out that chair for me? And the only word that comes to mind is table. It's very related. It's in the conversation. Chair might be there in your mind, but you just can't find the word chair. And it's often the case that it's when you're overwhelmed, that's when fibrofog or these cognitive issues might be more prevalent. And then the last of the core symptoms is fatigue. And if you think about going through the day, you get to 3 o'clock and it's as if somebody's just pulled the plug. The energy is completely gone. You don't have anything more to give. And fibromyalgia, along with other conditions that have this similar fatigue, can be referred to as energy limiting conditions. And the reason why it's important to describe it like that is it's not a case of you just need to go to your bed and get a little bit more sleep. It's not something that will be cured by that. So that's the core symptoms, those 4. And then you have other comorbid conditions that can come along and are quite common, like IBS or migraines, for example. And then there's other symptoms that people might collect along the way that are perhaps common in people with fibromyalgia, but they're not part of that core symptom set. Temperature dysregulation. Some people will feel too hot, some people will feel too cold. But there's a lot of other symptoms that people can have. But you need to have those core symptoms to obtain a diagnosis of fibromyalgia.
How prevalent is fibromyalgia?
It's quite hard to pin down. There is a lot of discussion around about it. We normally go by a verified survey that had 2.9 to 4.7%. The NHS quotes that as 5%. So 1 in 20 people is the nice, easy way of referring to it. But between 1 in 20, 1 in 50 people, because there's a lot of people that are suffering that aren't diagnosed with it.
You mentioned that it's not clear what exactly causes it. From what little is known, who's most at risk of developing fibromyalgia?
If you asked me that 20 years ago, it'd be quite clear that it would be potentially a 40-year-old plus woman, maybe a little bit overweight, maybe with some anxiety or depression. They were the stereotype. Thankfully, we have seen diagnostic guidelines updated. We've seen more scientific evidence coming about that makes us understand the condition more. So now there isn't that stereotype. So it could be anybody that it's going to affect. More women will be diagnosed with it than men. More people over the age of 40 will be diagnosed than people that are in their teens, for example. But it can affect anyone.
Are there any contributing factors?
There are some aspects of things that have happened in people's lives that might be almost, you could put your finger on it as that's the cause for some people. So often if somebody's given birth and then they've developed fibromyalgia after giving birth, or they've had sepsis, or they've had car crash, some sort of physical trauma, and then the symptoms happen quite quickly afterwards. Or it can also be that psychological trauma might be underpinning why some people will get it. Domestic abuse, adverse childhood events. But there's lots of people that can't put their finger on it. Research suggests that you might have a predisposition, a risk factor. It's not necessarily genetic. It is common in some families. But you might be having this risk factor, and then you have this environmental trigger, if you like. Something happens within your life. We can't necessarily say this person's going to get it or this person is more at risk of getting it, beyond that maybe if somebody in your family has it, maybe, and there's not really any concerted evidence round about this, but maybe that because it's more common in people's families, then you might be more at risk. But it's very difficult to sort of pin anything like that down.
How long does it take for it to be diagnosed?
The average at the moment is 2.7 years within the UK. We're still seeing people getting diagnosed 5 years, 10 years. And if I go back to that time point of 20 years ago, it was very common for people taking 5 plus, 10 plus years to be diagnosed. It's still the case now that you'll see lots of doctors. We're talking 5 plus, maybe different specialities. So you've got a lot of doctor's appointments that you're going to go to, and you're going to be asked the same things time and time again. And the way that you present as a patient, you'll talk about how you experience it. And that is your individual circumstances. So how I talk about it to the doctor might be different than somebody else does. And then the doctor has to pick up on those clues. The condition is very similar in how those symptoms that present to the likes of rheumatoid arthritis, MS, and a number of other conditions. So if you say something in a certain way and the doctor isn't asking the right questions or gets perhaps directed in one direction rather than another, then you might be going towards a diagnosis of rheumatology until that's ruled out. And you can understand from how that happens that you see the wrong specialist, they rule it out, then you're on to the next specialist to then see, okay, what was different that didn't allow you to be diagnosed with a rheumatological condition? So therefore, you're on to the next one. Then fibromyalgia potentially will be diagnosed. Not necessarily as the last thing when everything's been ruled out, but once they've ruled out and the presentation of your symptoms and your history fits the criteria for fibromyalgia.
You mentioned earlier the stereotypical view that in the past this was thought of as a condition that mainly affected women. Has that impacted on men getting diagnosed?
To some degree, I would say yes. But I have to speak to my own experience because it was about 25 years ago that I was diagnosed. And I was both younger than the stereotype and male, bit of a unicorn, as I sometimes describe myself at that point. But I was very fortunate. I didn't experience anything along that lines. I had to learn from other people's experience. And it is quite common that males feel a little bit disenfranchised or feel less supported because peer support, for example, is predominantly female because there's more females involved. So if you're talking about your own health condition and you're the only male in a support group, that might be a little bit more difficult. When you're interacting with health professionals, if they still hold part of that stereotype, then it's harder for you to be diagnosed with the condition. It's perhaps going to be a situation where you might be dismissed more as well. So therefore, you're not getting access to the support that you should do. Then you have the other aspects that are often part of being a male with a health condition. Maybe not going to the doctor as often as you should do, or when things are presenting that should make you go. Your own psychological makeup, whether it's the male psyche or whatever, that you have to be earning, you have to be supporting, you have to do this. There are challenges, but there are challenges towards women with the condition as well. But if men aren't aware or aren't being represented, then obviously it's going to be more difficult for them to gain support.
Once you've been diagnosed, what does the treatment pathway look like?
If I go back to one thing to do with diagnostics, there is a new diagnostic guidance that's presented by the Royal College of Physicians that makes it much easier nowadays for GPs and allied health professionals to be able to diagnose, and getting that diagnosed as quickly as possible, as I'm sure you can understand, then makes any treatment a lot easier, because if you're treating what you know, yeah, you're in a better position. If you're treating something that you're unaware of and you're not able to communicate about it, that just makes the challenge for the doctor and yourself a lot more difficult. But when you're addressing the symptoms, and that's what we try and do with fibromyalgia, we're looking at addressing, again, the pain might be the thing that the doctor goes towards first of all. But actually, which symptom they go for depends a lot of the time on what's the worst thing that you're complaining about. The fact that you can't get enough sleep, you can deal with the pain potentially. Maybe that's all right for you. You're in pain, but you can deal with it. But without having some rest and getting to sleep properly, you can't deal with your job. You can't deal with your life that you have. So often treating the symptom might be treating the symptom that's most prevalent for the individual. There is also non-drug treatments that are offered to patients, like cognitive behavioural therapy. And this is something that gives you an extra couple of tools in your toolkit that might allow you to deal with the goals that you have or the life that you're trying to live, help you deal with stress, help you deal with things that come at you while you're suffering from the condition. They might not lower the amount of pain that you have, but they give you tools that can allow you to perhaps function a little bit better. There are other things like increasing the levels of activity. And when we're talking about increasing levels of activity, it's things like Tai Chi, Pilates, walking. Ideally doing something that you enjoy, but soft, gentle exercise that you might be able to increase over time while listening to your body.
As I said earlier, survey data shows that the vast majority of us don't understand the impact that fibromyalgia can have on a person's life, which is where I guess having an organisation like FMA UK to turn to and reach out to others who can appreciate what you're living with can help. Talk me through the help and support you offer.
We try and provide a UK focus to supporting and making people aware of the condition. There's over 100 support groups that will be anything from meeting in a cafe with a handful of people to working with the local health board to improve education amongst health professionals. Going along to one of those support groups is something I will always recommend to people, because often you feel alone, you feel as if it's all in your head. You might be getting some encouragements to that idea from health professionals or your employer. So having that support group that can talk about different options, different treatments, giving you that support. So often it's the case that individuals will go to a support group and have this affirmation moment where they are not alone. They know that other people have taken this journey before them and there are options out there. As well as that, we provide helplines that can help with anything to do with any queries to do with fibromyalgia, but also benefits. How do you apply for benefits? What's the particular difficulties when you're going through the benefit system? Because it's an invisible illness, it's a changeable illness. So there are certain things that you have to navigate. You can be better prepared. We also do awareness campaigns. We fundraise. We work with researchers and clinicians. We promote research within our community. Basically, anywhere where we can get fibromyalgia mentioned, we will be trying to get that conversation going and getting more people talking about it.
My grateful thanks to Des Quinn. To connect through to FMA UK, visit the links page of the wordonhealth.com website. That's wordonhealth.com.
Word on Health. For your very best of health.
My final guest in this edition of the podcast is Chris Addison. Now, you may know him from his appearances in the hit TV series The Thick of It or Mock the Week. What you won't know about him is that he's someone who now lives with cluster headaches, which research shows few of us outside of those affected know little about. Something Chris, alongside the National Migraine Centre, are keen to change. I caught up with him recently between filming projects. I started by asking when he first encountered cluster headaches, and for someone who's never heard of one, how he'd characterise the pain.
Well, in order then, I suppose I started having cluster headaches. It's hard for me to tell how time works anymore because of my age and the pandemic making everything seem nearer than it actually is. But I suppose I probably started to have cluster headaches around maybe 5, 6, maybe even 7 years ago. It took a long time before I realised what they were, which is unusual, that age to start. So I sort of started in my late 40s. I'm in my mid 50s now. And it's an unusual age at which to get cluster headaches. There's an awful lot of different shapes to the disease, but if you read up on it, you'll be told that a sort of typical pathology of it is that it turns up in mostly men. It definitely turns up in women, but mostly men from sort of adolescency, and then it kind of goes away in your 40s or so. That absolutely didn't happen to me. What is it like? Well, this is going to sound like an exaggeration, and I want to start by saying that this is in no way an exaggeration. It feels like different people experience it in different ways and in different parts of their head. But for me, it feels like somebody has taken a long, sharp, pointy knife and pushed it through the top of my left eye into my brain, and then spends about 3 to 4 hours very slowly and continuously turning that knife. That's what it's like. It's an unusual pain, and it is a pain when surveys are done of people who suffer from cluster headache. Constantly, women are saying this is worse than childbirth. People who've been shot say this is worse than being shot. Like, it is right up there in terms of pain levels.
What went through your mind when you were encountering this pain?
I couldn't understand it. It's such an unusual pain. You've never had anything like it, and you're trying to run through a list of what it could possibly be. And because of where it happens to be located in my own head and in my own brain, I thought there must be some some sinus thing going on here. And so, before I sort of sought help, I was trying to take analgesics, I was trying to take, decongestants, things that seemed logical to me, none of which, of course, helped because they're not related to the condition itself. But what is actually going through your head is make it stop, make it stop. It's not like migraine. I think it shouldn't be called cluster headache. I think headache is a really unhelpful term because headache makes it sound like, oh, you can pop a pill for that. Or lots of people have terrible migraines and, can lie down in a room. It will pass in time. With cluster, you can't do those things. You can't sit still. You can't move. There's nothing that you can do. People who suffer very badly from it bang their heads against walls, self-harm, do things to avoid the pain. It's a really different thing. So when you experience it for the first time, it's impossible to understand what is happening to you. It just feels like the world is coming to an end in a way that you don't understand and in a way that you can't deal with. And because it's such a little known condition, it's very unusual for somebody who develops it to experience it for the first time and understand what that is.
And Chris, this is something you developed out of the blue.
I did. I had a series of odd things happening with my head and headaches around that time. And I sort of late in life developed migraine, but a visual only version of migraine. And then I sort of developed off the top of that a kind of weird chronic migraine thing, which manifests itself in an odd way where I was fine, but if I exerted myself in any way or if I bent over, I felt like my skull was about to explode. When the cluster headaches turned up, I assumed that all of those things were related, and it took quite a while ultimately getting to speak to a consultant, which is a journey in and of itself, to unpick the fact that these were not related and that they were separate issues.
How frequent were the attacks?
The way that cluster presents itself is, and the reason it's called cluster is because it comes in clusters. It comes in bouts, essentially. So lots of different people have lots of different ways that it sort of turns up for them personally. And that changes over time, as it has for me. When I started having cluster, what would happen is that I would get 2 or 3 weeks worth of one a night, possibly if things got bad, one in the day as well. And then they clear up. That would happen, say, a couple of times a year. And oddly enough, there are definitely people to whom it happens at sort of very regular times of year that they can anticipate, which is in some ways really helpful. Oddly, it happens to a number of people around the equinoxes, so sort of 6 months apart and so on. So that's how it started for me. And they tended to wake me up an hour after I'd gone to sleep. And that is not untypical for people who suffer from cluster. They're often called alarm clock headaches because they wake you in the night. And by and large, I would have one a night for that period of time. And then occasionally, if things were really bad, I would end up having one in the daytime as well. The shape of my particular disease has changed since then, but that's how it started. And everything I say here in terms of generalization must be taken as a generalization because there are all sorts of different versions of it. Some people suffer far, far, far worse than I do, as in they suffer greater pain and they suffer it for longer bouts.
You spoke of a journey with regards to getting specialist help. How aware was your GP? And give me an idea of that journey.
GPs, God bless them, do an unbelievable job. It's ridiculous when you sort of think about the range of human conditions that there are and what they're being asked to recognise, and the fact that some of those things might be very rare. So cluster is a good example of that. Roughly 1 in 1,000 people suffer from cluster. My GPs did not know what it was. And they ran me through a series of tests that you would expect, I suppose, to be run through. But of course, things being how they are in our health service currently, tests take a long time. Before I was sent for a scan, people had theorised certain things. Oh, well, that's caffeine. You need to come off caffeine. It's a sinus thing, and if you come off caffeine, that'll sort you. So I didn't have caffeine for ages. Didn't really help. Somebody prescribed me a steroid nasal spray that you might use to deal with hay fever or something like that. Obviously, that's completely useless. But it's a real stab in the dark. I mean, to be fair, that's sort of how medicine works. We think of medicine as being a tremendously scientific and rigorous discipline, which it is in many respects, but also it's just a bunch of things that we got right once and lucky guesses. And sometimes the journey of diagnosis has an element of that to it. People are trying to kind of rule things out. But it's not helped by the fact that, of course, the way that things tend to be structured now, gone are the days when, you and I were younger, of your GP was your GP. You knew who that was. You knew what their name was, and they knew you pretty well. Every time I go to my practice, it's somebody different. Most times these days, I'm not actually seeing anybody at all. I'm just typing into a format 8 o'clock, the same as everybody else. So it was a very long journey. Eventually, it got kicked upstairs, as it were. It got forwarded to the local headache team in our local NHS trust. And this must have been around lockdown. I got a call from a very he was quite an traditional doctor, very sort of high-handed. I could sort of imagine what he looked like, talked like that, and I said, "Oh, no, this is nonsense. This is nonsense. These general practitioners don't know what they're talking about. This is what it is." And he explained that I had these two different conditions. I had chronic migraine, I had cluster, and he gave me medication for those conditions. It actually worked very well with the chronic migraine, and it didn't work brilliantly with cluster. He gave me something that is often used to try and prevent attacks or bouts, which you sort of take constantly, and is a blood pressure lowering thing. So you have to go and have ECGs and all sorts of stuff like that to make sure that your heart can take it. And he gave me a steroid treatment for when the attacks turned up, which was designed to kind of turn off the receptors that deal with the attack, and hopefully kind of by the time they wear off, the thing has gone away. And both of those things were of sort of limited help. My journey is ongoing, and I had a really tough time of it last summer. So in the last, I guess, 18 months, things have kind of gone up a gear and then another couple of gears for me. Over the end of November 24 to the beginning of January 25, a sort of 6-week period or so, I had the longest bout that I'd had up to that point. And it had sort of turned up at that kind of time of year, the year previously, but for a much shorter time. Yeah, I was in it for 6 weeks, and I was beginning to worry. This is twice as long as I've ever had anything. I had been prescribed in the sort of intervening years. I was making a TV show called Breeders, which I directed a lot of. And I was on set and in the middle of a bout, and things got really bad. And I was getting an attack during the day, and I became really scared about that. How am I going to operate in my job? How am I going to, and this is not unusual for people who suffer from cluster, by the way, that a big question is, how am I going to operate as somebody who's supposed to be doing a job? How can I keep hold of that job? People lose their jobs, people lose their marriages over this stupid thing. And I called my local practice, and it just so happened that yet again I was speaking to a new GP who said, "Oh, well, I'm going to send you for an ECG to up your preventative medicine, but I can give you something to stop the attack when it happens." And I said, "What?" And she said, "Oh, yeah. It's a triptan. It's quite a strong drug. If you use it when the attack comes up, it should ward it off." And I thought, what the hell are you talking about? Like, nobody's brought this up to me in years. I enthusiastically went off and found a prescription for this. I was staying away, so I had to force the production to get me a private appointment, pay for a private prescription, all of those things that I wouldn't normally do. And she prescribed me, I always have one in my pocket, this little thing, which is it's a little plastic device that looks like an airplane symbol. And in fact, it is a one-shot nasal spray that contains this incredibly strong drug that is often used to cure migraines. When people with migraines are given it, they're told no more than 10 of these in a month. It's very strong and bad for you in other ways. So no more than 10 in a month. The cluster headache people, they say, just take it. Just keep taking it. The first time I took it, Paul, was like a revelation to me. It was one of the greatest moments of my life. The first time I took it, it was like I was rocking back and forth in pain on the bed in the spare room. as I'm wont to do when visited in the middle of the night by one of these horrors. And I got hold of one of these things, took the spray, and about 10 minutes later, it was like the knife in my brain just evaporated. It like in 3 seconds, boom, gone. And I remember sitting there for a minute going, that can't have happened. That can't be right. How is that? And it just solved the problem. It was unbelievable. I was so emotional with gratitude at the fact that thing existed. I was quite cross that I hadn't been told about it up to that point. But that, again, goes to your question, because GPs don't really know, it just happened to be that this GP knew about this stuff. So, but it's very, very, very strong. And when I had that big, long bout, I started to worry about taking so much. And so I really tried to kind of avoid taking it. And the non-pharmaceutical method for trying to cure the headaches when they turn up is oxygen. In fact, down here, there you go, if you can hear that is my tank of oxygen, which is kept by my desk with this very lovely mask that I have specially got for myself from the United States, because it's better than the one the NHS gives you. And I didn't have oxygen at that point, so I took the advice of a friend of mine who had also had cluster headaches. And I sort of powered round. When I got an attack, I would sort of walk at tremendous speed to try and get as much oxygen into my system as I could. So I looked like a lunatic, just power walking around Beckenham at 2 a.m. on Christmas with Ray-Bans on, because, the bright lights of the cars were too much for me to cope with. Passing people that I knew and kind of, in a real kind of, don't look at me. It was a very dignified way of spending Christmas. So I had that big long bout, and then I'm aware that I'm waffling. So the short version of it is I had an even longer bout over the summer when I was away in Ireland making a television programme over the whole of last summer. I had a 4.5 month bout of these. And there were points where I was in hospital on a drip in the day, on a steroid drip, to try and get rid of the attacks. And then I'd be shooting through the night. And it was a bad scene, man. Since then, I've sort of been elevated to like the team over at King's College Hospital. And next time this thing turns up, it's to them that I must go. So, the journey is ongoing.
Chris, I thank you for sharing what, by the sound of things, has been at times absolutely horrendous. I know you do so to help raise awareness. If I was to grant you 3 wishes with regards to changing the situation around cluster headaches, what would they be?
They would be, this isn't a headache. This is something else. That's a really important thing, because it's not. It's, what is it called? Is it trigeminal neuralgia is the actual name, I think. You have to look that up, but I think that's the name of the thing. I'd rather people called it TN. I'd rather it had a name that made it feel like this is a condition. I think I'd like people to understand the severity of it, because I know that a lot of sufferers who are far worse than me, and in fact, there is a superb book by the novelist John Niven, who is the friend of mine who recommended I power walk round like a lunatic. John used to get them, and he mercifully doesn't anymore. His brother, Gary, did suffer even worse than he did and took his own life over it. And John wrote a memoir about it called Oh Brother, which is such a wonderful book. It's really hilarious and it's really heartbreaking. And it's such a beautiful piece of writing. I don't think people understand that, jobs get lost, marriages get lost, because people don't understand. There's an organisation called the Organisation for the Understanding of Cluster Headaches, Ouch, their name is, and they are the sort of UK charity organisation that is a sort of patient representation and support group. And Ouch provide little cards for you to put in your wallet that explain what a cluster attack is, so that when people are trying to help you, you can just give them the card and go, which essentially says, go away. I know this looks awful, but there's nothing that you can do about it. And thank you for sort of bearing with me. I'd love people to understand that level of it. For my third wish, it would be that I would like more attention from the people who research drugs, because there is a seam of research into cluster headache that hasn't been undertaken, or at least has only marginally been undertaken. There is evidence, some of it scientific and some of it anecdotal, to suggest that small amounts of psilocybin, which is the psychedelic element that you get in magic mushrooms, for example, has the effect of not just curing the headache when it turns up, but much better than that, preventing the cluster in the first place. So if you're one of the people who knows when your cluster is going to turn up, or you can feel it. Like sometimes they don't suddenly turn up on you. Sometimes you get what are called shadows, which are like you can feel the area of your brain. You can just feel it. It feels a bit raw. It feels a bit, it's making itself known to you. And when you know that you've got a thing coming up, there is evidence to suggest that a small amount of this class A substance prevents the entire thing from happening. And there is a bit of research that has been done. I know there was a bit of research in Germany a little while back, but not an awful lot of it. Within the community of people who suffer from cluster, which includes a whole bunch of people online in the States called clusterbusters, their whole thing is 20 years of citizen science. That's a dangerous term and a dangerous thing. But, trying to help each other figure out how to use psilocybin. And the thing is, like, as much as it is potentially useful for at least some sufferers of the disease, as somebody said a few months ago, there's a problem, which is that even if your fellow sufferers can tell you, oh, this is the amount that you want, this is how you take it, nobody knows. If you have a naturally occurring substance like a mushroom that contains this substance, you don't know by looking at that mushroom how much is in there. It's not regulated, it's not safe, you don't know how much you're taking. Somebody, if they were to come along and figure out a way of synthesizing that, measuring it, and thereby prescribing it, it would be a miraculous thing. And I understand what's in the way of that, but that would be my third wish, that drug companies and others associated with that process turn their considerable attentions to that idea.
My grateful thanks to Chris Addison. To get help and support for cluster headaches, reach out to wordonhealth.com to link through to the National Migraine Centre from our links page. That's wordonhealth.com.
Word on Health. On air and online 52 weeks of the year with Paul Pennington. Word on Health. Your personal prescription for your very best of health.